Hello and welcome to the One Medicine podcast from today's practitioner. In each episode, we share the expertise of a respected thought leader. Some you'll know and others you'll probably meet for the first time. We cover topics important to you, always with a focus on improving the health outcomes of the patients you treat while expanding your understanding of the many healing modalities being used today. Hello and welcome to the One Medicine podcast. I'm Rob Lutz, your host and the editorial director at today's practitioner. And I'd like to take a quick opportunity to thank Dr. Supplement Store for sponsoring this episode. I will share links to their website and a little bit more about them in the show notes. But let's get started. Millions of patients struggle with fatigue, anxiety, poor sleep, and diminished resilience, even though conventional testing often appears normal. In this episode, we explore the sympathetic spiral of doom, a new clinical framework that connects mitochondrial dysfunction, oxidative stress, autonomic imbalance, and immune-endocrine signaling into a self-reinforcing cycle that keeps patients stuck. Our guest, Dr. Scott Scher, explains why treatment sequencing may matter more than the individual therapies themselves, how clinicians can identify where patients are in the recovery process, and why interventions such as breathwork, peptides, and nervous system retraining sometimes fail or even make patients worse when introduced too early. Welcome, Dr. Scher. Before we jump into our topic, which I think the audience is really going to find interesting, can you just share a little bit more about your background and any context you think that will kind of be pertinent to today's conversation?
Sure. Well, thanks for having me, Rob. So, an internal medicine physician, been in training, out of training now for a long time. I have an integrated practice outside of Boulder, Colorado, where I see people from my home. I was formerly a hospitalist for many years, so a hospital physician. Did my last shift just about a year ago doing that. I also grew up pretty alternatively. My father's a chiropractor, so he's still a practicing chiropractor on Long Island in New York, one of the largest chiropractic facilities, I think, probably in the country, if not the world, and how many people he sees. And so I grew up in that alternative space. And so I have a very significant, I'm very much acknowledging the combination of things. The integration is really where I find to be the most important for patients, not just a zero-sum game. It's really how best we can use allopathic, integrative, functional, it all together. And that's what I do in my own clinical practice.
Mm-hmm. Awesome. Well, thanks. And I'm really glad you joined the episode. So, I mentioned, the sympathetic spiral of doom, I think, in the beginning, which is a phrase that you have come up with. What inspired you to develop what you now call the sympathetic spiral of doom?
It's a funny story, Rob. Actually, I was talking to a friend of mine in California. She's an acupuncturist, and she had all of these people in California going and doing trauma work. So people that are looking at trauma, in a very deep way, sometimes somatic therapy, sometimes psychedelic therapies. And they were doing this trauma work and seeming to improve a little bit, but not actually gaining a lot of steam afterwards. And she was really understanding, and we were talking about it, is that they were feeling just so depleted after doing the trauma work, so tired, so washed out. And what this really was is that these patients had no energetic floor to stand on. And what this meant really was that, like, you could do all the downregulation of the nervous system that you can, but if you don't have enough energy to be able to sustain the capacity to make energy, then you're not going to see the benefits long-term for patients. And so she was seeing all these patients that way. And I was also seeing people that were trying everything out of the book, every tool, supplement, things like that. Sometimes having a paradoxical response to these kinds of things, doing breath work, doing meditation, doing yoga, doing cold plunges, and seeing how they all actually would have the opposite effect. And I realized that there was something there that was missing. And that was a pattern that I've, lovingly, although sort of ominously, named the sympathetic spiral of doom. So,
yeah. So, it makes me think about it. You hear a lot of times about, practitioners that are seeing patients and patient doesn't feel good. The labs come back normal. Nothing's really standing out. What do you think we're missing there?
Yeah. In this pattern specifically, there's two major aspects of it, right? So when you have, just to go back to the trauma example, you have somebody that is chronically stuck in fight or flight, right? They've had trauma as a child or as an adult or whatever. Their system never feels safe. They're always in sympathetic mode, okay? If you're in sympathetic mode all the time, you do these things to the system constantly, like produce tons of cortisol, tons of neurotransmitters like norepinephrine and epinephrine on a regular basis. And what this does over time is significantly dysregulates the system in multiple different ways. It dysregulates your hormones, dysregulates your immune system. But how does it actually do that? It does it by dysregulating mitochondrial function. So the mitochondria, as everybody knows, powerhouse of the cell, we have quadrillions of these things in the body. That's after trillions if you're following at home. So tons of mitochondria, especially in your reproductive organs, your brain, your heart, your liver, your musculoskeletal tissue. And so if you are stressing the system at all times, what the mitochondria start doing is being unable to keep up with demand. And they get flipped over into a whole stage of processes called the cell danger response.
Mhm.
And the cell danger response are basically three stages of what our cells try to do to protect themselves from a stress. Doesn't matter if it's physical, emotional, traumatic, etc. What they try to do is go through all these three stages to heal. But if you're under chronic sympathetic all the time, you can't do that. And when they get stuck, typically in CDR1 or in CDR2, which is where you cannot make energy effectively anymore.
Mm-hmm.
And then what the system tries to do as a result of that is compensate by making more energy, trying to get you outside to like actually get you to make more energy, but you can't do it very effectively because you're always in this chronic stress mode. So that's the classic loop that we would see, is that you have sympathetic activation causing mitochondrial dysfunction, causing compensatory sympathetic activation, leading to more mitochondrial dysfunction, right? So that's classic. And this is what most of us think about. But there's another way you can enter this loop. And this is the big deal, whereas, yes, sympathetic activation is a big deal, but also direct mitochondrial dysfunction is happening very, very commonly to many of us all the time. Most common reasons outside of the sympathetic activation are insulin resistance, medications like metformin or statins or other drugs we use like PPIs all the time, infections, your COVID infection, your viral infections, your severe infections when you had to go to the hospital or something like that. Those are all mitochondrial dysfunction generating, right? And then you also have hormone changes, things like around perimenopause, where estrogen goes up and down all the time. And like estrogen is a fantastic mitochondrial enhancer. And so what you have here is a direct mitochondrial stress. That direct mitochondrial stress causes that same CDR to be activated, that same CDR to not actually fully go through its whole process. Getting stuck, you flip over into the glycolytic state, or glycolytic lock is really what it is. You're not making energy effectively, and you get compensatory sympathetic activation. So even if you didn't have a sympathetic activation from the outside of the world, I call that a top-down stress. You had mitochondrial stress directly, which is your bottom-up way into this loop. So top-down, bottom-up, getting into the sympathetic spiral. And the key is that they feed on each other no matter where you start. And oftentimes, it's not just one or the other. It's usually a combination where you're going all right, you're sympathetically activated until something sort of falls out from underneath you, like your estrogen level, for example, if you're perimenopausal, or you just suddenly got an infection and then all of a sudden things just never feel the same. You start going into this loop where, and the patients, what they'll feel is that they can't recover as well. They're tired but wired. Everything they try, they're sensitive to. Their mood is all over the place. Their sleep is fragmented. Like their relationships are suffering. And there's obviously phases of this, but in essence, that's the sympathetic spiral in a nutshell.
Wow. And my guess is so many people are somewhere on that spectrum, right? They're, whether they're full on chronic fatigue syndrome, or they're not sleeping great, or whatever it might be.
Yeah. And that's really what I've decided here is that really there's 4 phases of the sympathetic spiral of doom as I understand it. And as I've been developing this, phase 0 is where we all want to be, which is not in the spiral. And the best way to describe phase 0 is that, do you remember how it felt to be 21 to 30 years of age? You kind of wake up, you're fine, no issues, no pain, no discomfort. Like your mood is good, your energy is good. Maybe you didn't sleep as well last night, but you still feel fine the next day. Maybe you went to college and went to bed at 3 o'clock in the morning, went to class at 8 o'clock in the morning the next morning or later in the next morning. The phase 0 is what I call relaxed capacity. It's where you have the capacity to rev up your nervous system anytime you need to, but you can downregulate as easy as you can upregulate at any moment. So it's not like you're laying on the couch not moving. It's a dynamic capacity to maintain your capacity on either end of the spectrum, right? And then you have phase 1, 2, 3, and 4, where you have the spectrum of being in the spiral. And people do bounce around at typically between phase 1 and 3, 1 and 2 pretty commonly. But phase 3 and 4 are the more extended levels of where people have a very difficult time getting out of that without significant help. And then the sequencing of the help is what I found to be so helpful here too, Rob. It's not just you can just do everything to the same person or different people the same way. it's like you have to be very clear that what's so important, no matter if you're sympathetically activated primarily or the mitochondria are also being dysfunctional primarily or secondarily, you have to focus on the energy side first if anything else is going to work better. And so not only is it a pattern that all of us are seeing in practice that I've just been able to sort of create here in a way that I hope can be helpful for you all that are listening, but also the sequencing and how we get out of it is
Mhm.
absolutely essential too.
Mhm. I had Dr. Jacob Teitelbaum on the podcast, and we talked about long COVID. And it kind of relates to what you're talking about here. He said it's an energy problem primarily. That's
Yeah.
that's if we're going to talk about the mitochondria, why do you put cellular energy production at the center of this model? I'm
Right.
curious.
And
Yeah.
yeah, it has to be, right? Because if you don't have enough energy, nothing is going to work. And
Mhm.
this is a classic example. I had a colleague of mine a couple months ago now, a very prominent doc. He was seeing a patient that was just always, very fight or flight,
Yeah.
chronically anxious. So what does she decide to do? She has multiple medical problems, of course. She has POTS, she has chronic fatigue. So she's on phase, 4 of
Yeah.
my spectrum here. She goes ahead and gets a sympathetic ganglion block, which is anesthesia to the sympathetic ganglion in her neck to shut off her sympathetic nervous system. What happens? She stays in bed, can't move for just about a month, right? Because you just took away her nervous system sympathetic tone,
Mhm.
but she had no ground to stand on, no
Mhm.
energetic ground. Okay. And this is why I've been now saying very often it's energy first,
Mhm.
energy first. And what I mean by that is if you can create more of a mitochondrial support so
Mhm.
that when you downregulate the nervous system, then there is a floor to stand on
Mhm.
once the nervous system is no longer in fight or flight. And so if the mitochondria are not working well, nothing else is going to work well. Your immune system is not going to work well. Your hormones aren't going to work well. Yeah, your heart's not going to work well. I mean, your musculoskeletal tissue and the kidneys and
Yeah.
everything is from there.
Yeah.
And so if you focus on the energy first framework,
Mhm.
that is the key here because if you give somebody enough energy that you can actually decrease their nervous system tone appropriately and effectively. And so,
Mhm.
one thing I've been very fond of saying to my patients lately that have anxiety is like, you know what? You need more energy. You'll have less anxiety that way.
Mhm.
And that is a bit of a paradoxical
Yeah.
idea, right? Because you think, well, if you have anxiety, well, you got to calm down, right? That may be the case. But if I calm you down and you're in phase 3 or 4 of this spiral, you're not going to feel very good when I calm you down.
Yeah.
And I've seen it in front of me, like when somebody had taken something to calm them down and they have this, they crash, they have this anxiety that's worse and
Mhm.
like kind of like a reactive anxiety. And so for me, it's all about focusing on how well the cell can make energy, allowing it to be able to transition through those cell danger response phases and complete them and
Mhm.
go back into optimal functioning where they can make energy effectively from oxygen again.
Mhm. So that's your starting point typically is really kind of looking at too early in this conversation to kind of share a little bit about how do you do that?
Yeah.
I mean,
No, I think that's exactly where we're rolling here.
yeah.
Whereas we all recognize our patients on some level attributing having attributes of being in the spiral in some way, right? I think, and for me as a clinician, the question just becomes what is the sequence that's going to best support them
Mhm.
to escape said spiral
Mhm.
and maintain their capacity to do the things that they want to do, become in that phase 4. So when relaxed control, the capacity returns, right? And that's really what we're working with or trying to work towards with our patients is to give them that capacity back.
Mhm.
And that capacity starts with energy. And for me, it's a process that I've developed over the last several years now, where I really understand that if you can focus on mitochondrial function first,
Mhm.
not the only thing you need to do, but focusing on mitochondrial function first, optimizing vitamins, minerals, nutrients, cofactors, all the aspects that are related to mitochondrial function. You
Mhm.
have to look at toxins in the environment. You have to look at, what's happening in the gut. You have to look at neurotransmitters and hormones. Like these are all very, very essential. But you don't want to wait too long to start downregulating the nervous system too.
Mhm.
Now, the problem with that is that the things that I just mentioned, vitamins, minerals, nutrients, and cofactors, gut health and optimization, that takes time.
Mhm.
It doesn't happen overnight. And you have to be super careful on how you start bringing that in a patient that's already significantly dysregulated. And this is very common for a lot of practitioners that are listening is that you give something to your patient and they react to everything. Like they react even the small amounts of supplements, they crash or they just don't do well. These are your very sensitive patients, right?
Hmm.
That's like a stage, 4 of this particular pattern that I've been describing. And so what I've realized is that what you can really do right now is support mitochondrial function with some very simple things that can work very quickly. And the compound that I've found to be the most compelling here is a compound called methylene blue.
Hmm.
And methylene blue is a very, very interesting compound. It's been around for a very, very long time. It's not the only thing that I use, mind you, right? I'm using the other things at the same time
Hmm.
to support mitochondrial function. But within about 3 to 5 days of being on the right dose, your patients is going to start feeling better. They're going to start having more energy, more capacity. And that's because of the amazing ways that methylene blue works in the mitochondria.
Hmm.
And using that has been a game changer in my practice because now I can give my patients a leg or a floor to stand on
Hmm.
or to sit on a chair, I guess, whatever the analogy might be. And then as a result, they're able to make the efforts and do the other things to support their system, like
Hmm.
change their diet, their lifestyle, start drinking more water and things like
Hmm.
that.
Hmm.
And we can also downregulate the nervous system now because they have a more energetic floor as well.
Hmm. That's really interesting. It makes a lot of sense. And you might have touched on this a little bit, but how do mitochondria and the autonomic nervous system communicate with one another? How's that happening? Doesn't, I mean, I'm not a practitioner, but that seems trying to figure out how that kind of fits together.
Oh yeah, absolutely. So it's they're very much related. If you have chronic sympathetic activation, you are stressing the mitochondria at all times. Your mitochondria, your body thinks that you're running from a lion at any
Mm-hmm.
moment, even if you're just doom scrolling or yelling at your kids or something like that. Or
Hmm.
hopefully not yelling at your kids too often, but you get what I mean, right?
Yeah,
And
yeah.
so when you have the chronic sympathetic activation, you're pumping out cortisol.
Hmm.
Cortisol, your primary steroid hormone. It's one of your primary hormones for revving up the nervous system, getting in that sympathetic dominance and staying there.
Hmm.
And what that does is tell your mitochondria, we need to make as much energy as absolutely possible so that we can manage the demand that you're putting on us.
Hmm.
And what that does over time is significantly stress the mitochondria into a place where they cannot keep up.
Hmm.
We don't only just make energy in our cells, right? We make ATP, but we also make reactive oxygen species or free radicals. We make water, we make carbon dioxide, right? But the free radicals have to be neutralized when they're made by antioxidants. And if you're continually under stress mode, you can't keep up. Your antioxidant capacity cannot keep up. And as a result of that, you get too high of a reactive oxygen species load, you get into that cell danger response and you cannot get out of it.
Hmm.
And that is where the sympathetic activation really does huge amounts of harm on our cells because the mitochondria can't keep up. Those cells cannot do their functions that they're supposed to do. So they can't make hormones. They can't make neurotransmitters. They can't make immune cells. They can't make your gut lining. They can't, and the list goes on and
Hmm.
on. And so the sympathetic activation is absolutely crushing the mitochondrial capacity to keep up. And
Hmm.
where the parasympathetic nervous system comes in, which is your rest and digest mode, is that's where you have the capacity to shift out of the cell danger response. That's where you have the capacity to detoxify, to heal, to recover, right? And that's where we're really trying to get more of our patients is to be in parasympathetic mode at least more of the time, right? And it's not like you want to always be there, but your default state shouldn't be in sympathetic. Your default
Right.
state should be in parasympathetic.
Yeah.
And I see this all the time with my patients. Their HRVs in the tank. Their sleep scores are terrible. Like, but they feel fine. Like this is just how they've been operating, right?
They
Like you
think
can,
they feel fine.
yeah,
They
exactly.
feel
In
normal for
quotes,
them.
yes,
Right.
in quotes, they think they feel fine,
Yeah.
but their HRV is in the tank and they don't know why. Like I'm doing everything right, doc. My HRV is terrible though. I sleep okay, but my HRV says it's really bad. I'm not getting enough deep sleep. I'm getting 10 minutes, although I feel like I'm getting some rest. I'm not getting much at all. Like
Yeah.
I don't know why my mood's all over the place. It used to be just fine. Like I used to be able to recover from exercise after a day or two max, and then it
Yeah.
takes me a week, and so that the list goes on, and you have to answer. You have to always ask the right questions as a
Hmm.
physician or practitioner.
Hmm.
Taking a history is really really important here,
Hmm.
or having good screening tools, and or having a good questionnaire,
Hmm.
or 7, depending on the person and
Yeah.
the kind of clinic you run. But you can really piece this out quickly, and I think if you've been in practice long enough, within about 3 to 5 minutes max, you really understand, at least I understand, whether I'm going to be able to help this patient directly by doing labs and giving them supplements,
Mhm.
or if that's not even going to go far, right?
Mhm.
And that's the sympathetic spiral that I'm talking about, where
Yeah.
the labs and supplements on their own, they're not going to cut it because you have that sympathetic overload or that
Mhm.
overhang that's coloring everything. And where we get stuck as practitioners is either place. Either let's just downregulate the nervous system and they're going to feel better, they crash, or let's just give them stuff for their energy capacity and see if they feel better, and they don't.
Mhm.
Why? Because you didn't address the sympathetic or you didn't address the mitochondria on either side of things. And
Yeah.
that's really what I think has been so crucial to helping so many of my patients recently is over the last year or so when I've really kind of figured this mode out.
Yeah. So again, I think you touched on this, but what does the typical SSD patient look like in practice? You
The
know?
typical SSA patient is going to look like your average person going to the doctor saying that they don't feel good anymore.
Mhm.
And it can be mild, like coffee is structural. You need coffee every day, not sleeping as well, a little bit more fragmented, mood is a little bit dysregular. You're just kind of feeling like whenever you travel or any additional stress comes on, you have a hard time handling it.
Mhm.
To the end of the spectrum, which is, chronic fatigue, always tired, wired, fragmented sleep. No matter what you do, you feel like things are worse. You
Mhm.
try to do the breath work, the cold plunges, the yoga, and try to calm down, but things feel like they're actually falling you're actually getting worse instead of better.
Yeah.
And so it's a spectrum there. And we do move around in that spectrum, as I mentioned,
Mhm.
but it's most of us some of the time,
Yeah.
at least in that phase one and phase two side of
Yeah.
things. And that's okay. What's nice about the phase one or phase two of this is that you don't necessarily have to be so sequenced about it. If
Mhm.
the system still has significant energetic floor, at least some, you can just work on calming down the nervous system and
Mhm.
things are going to be all right. Taking more breaks during the day, getting some sunlight, getting off the screen,
Yeah.
just working on getting the same bedtime every night,
Yeah.
in phase one or phase two can be fine for a lot of patients. But the phase three and phase four, it's just not going to cut it because
Mhm.
they need energetic floor so that they have something to land on when you're down regulating their nervous system.
Is there a way for you to determine their energetic floor? What do you look for?
Yeah. So
Test.
I do a lot of testing with patients. I do metabolomic testing, which
Mhm.
is small molecules that are responsible for the real time working of the cells.
Mhm.
And you can do metabolomic testing. This is organic acid
Mhm.
specifically testing. I use a number of different companies to do this, but
Mhm.
that's my way of really understanding what's happening real time and also look at the gut, look at neurotransmitters, look at
Mhm.
hormones. So I'm looking at all that. But
Yeah.
honestly, as a clinician, within about, again, 2 to 5 minutes at most, I get a pretty good sense of where people are
Yeah.
and where they're going to need to go.
Yeah.
So a lot of this is going to be subjective for your patients, right? But there are some markers you can absolutely see, especially in people under chronic sympathetic activation, that you can see improve as you're starting to unwind this loop
Yeah.
and really find ways out of it.
And so would a patient need to have some kind of a tracking device for their sleep and their HRV? I mean, obviously that could be helpful for this, but
It's
what if they
it's
don't?
absolutely helpful. Yeah,
Yeah.
it's absolutely helpful, but they don't have to have it. A
Yeah.
lot of this can be objective in the
Mhm.
sense of, well, how do you feel, day to day? How well do you recover? How, is something that's stressful make you feel like the world is going to end, or do you have a capacity to work
Mhm.
your way through it pretty quickly? So I've created a questionnaire that I think is helpful for patients, and it's
Mhm.
also a way to kind of scale them on a number, at least a number scale as to where they might fit
Mhm.
on the sympathetic spiral, which can
Mhm.
be helpful because then you can also repeat it over time and see how things change.
Sure.
It's one of those things where the challenge, Rob, that we have is that our society has really developed an affection for the hustle, for
Mhm.
stress. And it's very difficult for people to take that gas pedal off. But once you start doing that and you give people the experience of being able to function better, even in high stress situations when their
Mhm.
nervous system is not as activated,
Mhm.
that's when you can see massive benefit. And we talked about the mitochondrial side of things, but there's also the downregulation of the nervous system and how do you do that, right?
Mhm.
Obviously, you want to deal with the trauma and anything major that might have happened in their past, but do you have enough energy or do your patients have enough energy to do that? And the answer is probably not if it's
Mhm.
been going on for a long period of time.
Sure. Yeah.
So you have to think about what are the small things you can do now to start down regulating before they can do the deeper work. It might happen 3 or 6 months later
Mhm.
once they've built that energetic floor. And so I really try to leverage the GABA system here specifically.
Mm-hmm.
GABA is your primary brakes of the brain. So glutamate, excitatory, GABA inhibitory.
Mm-hmm.
The combination is about 80% of your brain's neurotransmission.
Mm-hmm.
And glutamate gets converted into GABA in the brain. They're supposed to be in balance with each other.
Mm-hmm.
And so GABA is the unsung hero of the brakes. And most of our patients that are chronically stressed, they are GABA deficient.
Mm-hmm.
And the challenge is you can't just give GABA as a supplement. GABA is too big of a molecule to get across into the brain.
Mm-hmm.
If GABA works for your patients, it is diagnostic for a leaky brain or a leaky blood-brain barrier,
Mm-hmm.
which is almost always correlated with a leaky gut.
Mm-hmm.
So if you optimize somebody's gut, their blood-brain barrier typically gets better as well. And so you want to use other compounds that can then enhance the GABA system. I use things like L-theanine and kava and CBD and CBG, which are non-psychoactive.
Mm-hmm.
And I use others for sleep that are more longer acting, like magnolia bark and hanokyle, dihydrohanokyle, something called agarin, which is from a mushroom called the amanita mushroom.
Mm-hmm.
These are really great at optimizing the GABA system directly.
Mm-hmm.
And so I use these
Mm-hmm.
so that my patients can get the experience of what it feels like to have a nervous system that is not as activated.
Mm-hmm.
Having the experience allows them to know where there is, because many of my patients and many of yours that are listening do not remember what it feels like to not be in sympathetic mode.
Mm-hmm.
And so to give them the experience, then they can get back there with meditation, with yoga, with breath work when they have an energetic floor, of course,
Mm-hmm.
but they know where there is. And that's what I think supplementation can be so powerful for in this particular capacity.
Mm-hmm. Yeah. What you said made me think of something that I work with some other entrepreneurs with a coach. And one of the things we talk about is, slowing down to speed up. You've always got so much stuff going on, but if you can't slow yourself down to react appropriately and be present and so forth, then you're not going to get where you need to go. And so that was something that you just made me think about. Okay, so let's talk one last thing. How do you distinguish between SSD from burnout and adrenal dysfunction, chronic fatigue syndrome, and long COVID, or is it all part of it? Kind of various.
Right. So
Is there a
the sympathetic
Yeah.
spiral of doom is not a diagnosis. It's a pattern that we see in a lot of different
Mhm.
conditions, including the ones you've just mentioned. What this just helps, I think, me understand, and I hope some of you, is that we have this loop that's happening with a lot of these chronic conditions. If you have a chronic condition, you are in the sympathetic spiral on some level.
Mhm.
And if we work on that energetic floor, then everything else is going to get easier. But it's not the only thing you work on. You work on sympathetic activation, and then all of a sudden that loop starts breaking. It starts opening up and stops spiraling. And then all of a sudden, the treatments that you're looking for that to work are going to land.
Mhm.
And that's the big difference, is that we're trying to really help these patients, but we are so stuck on sometimes just that specific marker, that specific issue, when we
Mhm.
don't realize, if we just take a 30,000-foot view, that all of a sudden, if we just energetically support them, drop their sympathetic nervous system down, then all the things that we're trying to do with our patients, help them do, facilitate them, is actually going to finally start working.
Mhm.
And it's one of those things where, and I've seen this in practice, you just give somebody supplements for their mitochondria to start working better and nothing gets fixed, right? Everything is the same. It's because they're so sympathetically clamped down, right? And the other part of this is that if you just deal with their sympathetic nervous system and don't optimize mitochondrial function, they can crash. And so it becomes like a base level, Rob, for me, is that, I have a nonprofit that I help run. It's called Health Optimization Medicine in Practice. And it was founded by a colleague and mentor of mine named Dr. Ted. And the idea was, well, what is this sort of foundation that sometimes we get lost finding, right? Because as clinicians, you're looking at we're better than we used to be. Allopathic doctors, Band-Aids for blood pressure, diabetes, et cetera, right? Functional medicine, integrative doctors are looking more for that root cause
Mhm.
of illness, which is great, right? You're looking for the root cause of the fatigue and the fibromyalgia, whatever, right? So you're looking for the virus and the bacteria and whatever, right? What we have done is like, what if you looked at the root causes of health as a foundation, right? Not just looking at the root causes of a disease. And then how does a system stay healthy?
I like
The
that.
system stays healthy with optimizing mitochondrial function, with the cellular function. Like cell itself is the root, is the base of all of your tissues, your cell, your basic cell. its nucleus, its cytoplasm, its organelles, including the mitochondria, its cell membrane, right? And so many of us in the functional integrative worlds are doing this work, but
Hmm.
we're doing it in the context of a root cause analysis, which I think sometimes can lose the forest from the trees in the sense of if you just focus on foundational biomarkers, then a lot of the other things are going to get better on their own rather than having to address them. And this is where it gets interesting, where you have immune system reactivation of things like Lyme and mold and EBV. And oftentimes, those aren't the problem. The problem is the immune system itself and optimizing immune system function, and optimizing the gut, optimizing the mitochondria, down regulating the nervous system, right? And so it doesn't take the place of any of that stuff. It just says, well, maybe there's a energetic floor, as I've been describing it,
Hmm.
and a phase zero where we can try to get our patients so that they can heal, detox, and recover better from anything else that life has or may throw at them.
Hmm. Yeah, just support them in such a way that their ability to be resilient to whatever comes across, they're more suited for it at that point. They're more,
Right. Or just simply that it's easier to treat them, right? If
yeah,
like if you have a trauma to a limb and you're more well optimized, you're going to recover faster from that trauma.
yeah.
If you get an acute Lyme tick bite and you're relatively optimized, you're going to heal faster, right? And so the idea is that we create a foundation of health, of resilience and capacity.
Hmm.
And what I think is just so important, all of the practitioners listening know this, is that it's pretty easy to do lab testing on patients. It's pretty easy to give them supplementation, but it's pretty hard to downregulate their nervous system. And that's really where we have, as a clinicians, really have to spend a ton of time
Hmm.
and give people a roadmap. But the roadmap is only going to work if they have that energetic floor. And this is where a lot of us, me included, failed in the past because I just thought, okay, you know what? This person's crazy, or they're just have a lot of anxiety. We need to just work on their anxiety, right? And then I would get nowhere. And then I would be like, well, why am I getting nowhere? Well, every time I try to do something, they crash, or every time I do something, they have a paradoxical response, or whatever it might be.
Hmm.
And so a lot of clinicians, and me included for a long time, would send them to psychiatrist or send them just to another doctor
Hmm.
instead of trying to address it themselves because it felt like a psychological issue. And yeah, there might be psychological things there for sure that need to be addressed, but it's that, again, I keep going back to it, but that energetic foundation
Hmm.
that we can do as clinicians that's going to make every other intervention from a sympathetic downregulation perspective work
Hmm.
and land so much better. And then you open it up. You, instead of being contracted, you expand your patient's capacity to finally heal from their Lyme and their mold and their,
Hmm.
those things need to be addressed 100%, not
Yeah,
100%, but many of the times.
yeah,
And so it doesn't take the place of it. It just makes everything work better.
yeah. That's great. So can you give me, so we're talking sequencing a little bit here. I think that's an important one for us to stick with for just a minute, but can you give an example from your clinical practice where sequencing completely changed the outcome?
Yes. And so a couple different examples. I'll give you one interesting positive example first, because let's start positive, right?
Mhm.
So there was a colleague of mine, decades of anxiety, tried every SSRI in the world, multiple interventions, nothing worked. He started on some methylene blue. Within about a week, his anxiety went away for the first time in his adult life.
No kidding.
Okay.
Wow.
Yeah, first time in adult life. He called me and he's like, Scott, why did this happen? And I was like, well, you're not the first person to tell me this. I've had
Mhm.
people start telling me, yes, I took methylene blue, my anxiety went away. I took methylene blue and I started sleeping better. I took methylene blue, my HRV is better. Well,
Mhm.
why is this? Right? Because all of a sudden there's more energetic floor, like I
Mhm.
said. And
Mhm.
then or are anxiety and depression, a lot of mental health disorders, are they purely neurochemical? We know that's absolutely not the case. We know that
Right.
there's a huge mitochondrial component to every single mental health disorder. Okay.
Mhm.
And so once they started getting enough energetic support, at least some of my patients, this one friend of mine, I've had others with depression, even
Mhm.
bipolar and others, they start feeling so much better. Now, on the other side of this, there's a patient of mine who was working with another doctor at the same time. This other doctor was focused on Lyme mold, and I don't typically work with that in my particular practice. She was doing that. I was starting to work with her I just had started working with her
Mhm.
on some of these foundational biomarkers. And so we had just got done an intake, and then I get a call from her the next week that she's in bed. She can't move. And I asked what happened. She's like, well, my doctor, very well-meaningly, obviously, gave me something to calm down my nervous system, and I crashed. This is a lady that had mold in her house that she was still trying to leave the house. She was still getting exposed on a daily basis. She'd been diagnosed with Lyme. She had, chronic fatigue. Her energy was all over the place. Poor girl. And so she wanted to come see me to do some foundational testing. And what I realized, what we realized what happened here. So once she recovered, which took her some time, we did the reverse, right? We started with energetic support. I started on methylene blue. I started on very low doses, about 8 milligrams to start off with. Maybe she's up to 12.5 at the end of it. So small amounts, clean stuff. Got to make sure you're getting clean methylene blue when you're getting it. And then we slowly, over the next couple of weeks, started very slowly downregulating her nervous system, starting with GABAergic compounds that I mentioned earlier. I started also working on some of that vitamin, mineral, nutrient, and gut support. And then slowly, over about a month or so, we were able to see this shift. It was like this crossover moment where her nervous system was much more regulated and her energy was not trashed. Now, did she feel 100% better? No, she did not feel like this took her months to feel better, like entirely. Like she's still on her path, but she's significantly better now. But it was after about 30 days or so where we could really start going deeper into some of her cellular machinery and start making bigger interventions that she could actually handle. And that would mean actually working on doing a gut cleanup, for example. I don't necessarily do that right away in somebody like this because you're going to make them crash. And so we waited about a month. We started cleaning up her gut. We sealed up her gut. And then all of a sudden things got significantly better. Peeled off her methylene blue. She didn't need it anymore. I still had her on the GABAergic support and she's done great. And I've seen this like across the spectrum. I've seen people that are perimenopausal women. A number of them that I've worked with and also my colleagues where, again, the floor goes out underneath them during menopause or perimenopause when estrogen levels drop down because women in midlife are doing a lot. They have kids, many of them have jobs and their stress is, high. They're doing okay until that mitochondria starts getting less support because of the estrogen levels. And so what I've seen in these patients is that you can just start giving them HRT, right? And maybe some methylene blue depending on the patient. And all of a sudden they feel better. And then you can start working on their stress at the same time. So I've seen it in a lot of different categories.
Yeah, it makes so much sense the way you're describing all this. I mean, obviously you've seen it in your practice.
Yeah.
Is there anything else that you want to talk about as far as the 4-phase model? Yeah, I think you touched on it. Bridge interventions. So there's some things you didn't use that term yet, but I know that's something you've used before. Anything else you want to say about the 4 phases?
Well, I think, again, these are relatively arbitrary, of course, everybody. I just created them because I felt that it's always nice to have some categorization. But in general, it's a spectrum of how severe their sympathetic spiral is looping and spiraling, really. And so the deeper they are in the spiral, the more important it is to sequence things from an energy first perspective. The less steep they are, or the more shallow, I guess, in this capacity, the less important it is. But what it comes down to is meeting the person where they are and then taking them slowly through this journey. I think the main aspects that we all want to do, all of our patients really want, is to feel better tomorrow. Right. And so we have to acknowledge that if you're further down that spiral, it's going to take more time to get there. But finding ways to help right now is absolutely essential. And that's why I found this particular compound, methylene blue, to be so essential, even though I know it's controversial in some level. It's not. It's a very blue coloring. And it doesn't come from the ground. It's a synthetic material, but we live in a synthetic world and we need synthetic things to help us sometimes, like antibiotics for infections. And not everything natural is good for us. You know this, right? Cyanide's natural and so is arsenic. Right. Fun fact, the antidote for cyanide poisoning is methylene blue, by the way. And so, but the nice thing about methylene blue is that it helps right now. And so I use that as the energetic support. And then I use GABAergic compounds very quickly once the energy support is in place so that you have a way to, again, downregulate the nervous system without getting them to crash. And then everything opens up. Everything opens up so you can actually see your vitamins, minerals, nutrients land. The lifestyle, people are willing to make more changes. Right. They're willing to get out of a relationship that sucks because they have enough energy to do it. They're willing to think about their work in a different way or do some mindfulness training or go to yoga class or
Right.
do some breath work because now they have enough energy and capacity to do it.
Mm-hmm.
So I think that the phases aren't as important as understanding that there's a spectrum here. I
Mm-hmm.
do have questionnaires available. I have a whole sympathetic spiral of doom protocol that I've developed as well that
Mm-hmm.
people can reach out and get. And I'm sure we'll give them some links at the end here.
Yeah.
But I think in the end, the goal is to understand that this is the foundation that some of us are not thinking about in this way.
Mm-hmm.
And I think it'd be super helpful to kind of bring into your practice and integrate it into the things that we're already doing.
Mm-hmm. Yeah, it really makes a lot of sense. I know we're kind of running out of time here, but so maybe a clinical pearl, if a clinician remembers only one concept from our conversation, what would that be?
That's a good question. Well, a couple things come to mind. The first thing that comes to mind is that I tell my patients all the time they need to have more energy to have less anxiety.
Mhm,
And that's an interesting paradoxical way of describing this, but it
mhm,
does make your patients double take for a minute and go, wait, I need more energy. And the other one that I say to my patients in a very nice way
mhm,
is they need to calm the fuck down, but I do that in their capacity of understanding it in this way, right?
mhm,
Now, the way that they're going to heal, the way that they're going to recover, the way they're going to detox is by calming down the nervous system. But let's do this in a sequenced way.
mhm,
And so I guess the final thing would be energy first.
mhm,
I mean, by supporting mitochondrial capacity first,
mhm,
everything is going to get easier to do. It's
mhm,
not the only thing that you need to do, but
mhm,
it's the primary, the number one thing that we can do to our patients to
mhm,
help them now. And there's lots of different ways to support mitochondrial function. I mentioned many of you are doing these already.
mhm,
But what are the things that we can do that are going to work within about 3 to 5 days?
mhm.
There are less of those things.
Right.
And that's where, again, methylene blue has become my workhorse here.
Mhm,
It's not the only thing that I do. I
mhm.
change diets and lifestyles and all those things. But when they have more energy to do it, it becomes easier
Yeah.
and they can go further faster on their path of optimizing their
It
health.
makes total sense. I mean, if you don't have any energy just to get out of bed, let alone change your diet or get out and get some exercise or try to meditate, forget it. You're just you can't do it. So that makes a lot of sense that that's where you start is to get that
Yep.
base level up. We will definitely include links in the show notes so other practitioners get in touch. The methylene blue, I know that'll be something people are going to have some interest in learning more about. I guess maybe one last, if listeners could adopt one new habit in evaluating patients, what would it be?
That's a good question. I'm just thinking about the best way to describe it. So, one new habit that a practitioner could start bringing into their practice, I think it would be,
Hmm.
as I said, is an energy first framework, right?
Hmm.
Which is that we know all of our patients are complaining about low energy
Right.
or anxiety or depression or insomnia or weight gain. But
Hmm.
all of these things, in essence, are an energy problem at their base.
Hmm.
Not the only thing that they are, but it's a huge piece. So mitochondrial medicine is the wave of the next several years at least.
Hmm.
And so if you're not looking at mitochondrial function now in some ways, I would highly recommend as a practitioner you start doing this.
Hmm.
There's a lot of advanced testing out there for mitochondrial function. That is controversial still. There's not clear evidence that those tests are great yet, but they likely will soon.
Hmm.
They are data points. I use organic acid testing in my clinic, in my
Hmm.
practice. That's what we teach at Health Optimization Medicine in Practice, which is
Hmm.
a nonprofit that trains practitioners
Hmm.
on how to optimize health rather than focus on disease. And so, if you're interested in bringing something back into your practice that's truly going to be transformative, I would say metabolomic testing and
Okay.
looking at organic acids and looking at mitochondrial function in that capacity. And then, if you want to get fancy, go look at some of those other mitochondrial tests that are out there as well and potentially use those as another way to support your data and to support the frameworks you're using with your patients.
Yeah. Well, that's great. I know we're short on time, so I really appreciate everything that you've shared today. This was really, I found fascinating, and I think our listeners will as well, and really giving them a different way at looking at probably so many of their patients that are coming in and a new way or a new framework and how to approach it. It sounds like you've had a lot of success taking this approach enough that it's something you really want to share with others. So thank you so much for coming on the show. I appreciate it.
Yeah, it's my pleasure. And if those are interested at learning more, is it okay if I give them links and things, Rob, as
Yeah,
well? Or
we'll
is it
give them
okay?
links and everything,
Okay.
but
Okay.
you're welcome to, share it verbally right now, but it will be in the show notes.
Yeah, yeah. For those who are just interested, I mean, I have a couple different places you can go. I help run a company called Troscriptions, which is a company that makes precision dosed formulas in the form of an ingestible troche. I mean, you can check it out at troscriptions.com. We have a practitioner only ecosystem. So as a practitioner, you can really get a sense of what we do there. We have products with methylene blue. We have products that help downregulate the GABA system. We have protocols. We have the sympathetic spiral of doom protocol down there or in there.
Mhm.
We can also give that probably as a free gift to your listeners if they'd like to, Rob.
Awesome.
We also have a questionnaire that you can send to your patients to get them a sense of where they are on the sympathetic spiral in phase 0 through 4, as mentioned. So
Mhm.
my goal is education here. You guys check out the ecosystem. If you think you've liked the products, that's great. But I hope this really does help, think about things a little bit differently
Yeah.
than you have already and give you some additional ways of helping your patients. So
Right. Well, again, thank you so much for this and sharing it. And I'd like to have you back on the show sometime. I think there are a lot of other things I'd like to talk to you about, but thanks so much.
thanks for having me, Rob. This has been fun. I appreciate your time.
Thanks for listening to the One Medicine podcast. I hope you found today's episode interesting and came away with a few insights you can apply to your practice. If you're looking for the show notes, they can be found in the link below. If you want to go deeper on this topic or anything else, please visit todayspractitioner.com and consider registering for our weekly newsletter as well. Thanks again, and I hope you'll join us next time.